Last week we talked about nutritional alternatives to using ibuprofen or NSAID drugs for back pain. This week we want to talk about how movement can help eliminate back pain. Hi, my name is Dr. Jeff Anderson. I'm a doctor of chiropractic and acupuncture in the southwest Denver area. For over 22 years I've helped people eliminate their pain and help get them back to their lifestyle as quickly as possible. Today I have Miss Mickey Wadhams, and we're going to share with you something that I see very commonly in my office, and that's called lower cross syndrome. In fact, lower cross syndrome is probably the chief culprit for most people's back pain. Lower cross syndrome is a cascade of events that occurs in the body that is due to muscle imbalance, and this muscle imbalance usually comes from prolonged sitting. When we sit for too long, what happens is we engage that hip flexor and the hamstring for too long, and it squeezes our body together like this. When we're crunched in like this, a couple of things happen. Those muscles become facilitated. They're working too hard or overtime. As a result, the gluteal muscles become inhibited. There's a law called Sherrington's law of reciprocation. If my bicep muscle contracts, the tricep muscle has to relax to allow the bicep to contract. The same phenomenon is going on here. So as my hip flexor starts to contract, the gluteals become inhibited. Now my body does not want to stay leaning like this, so my hamstrings and my back muscles start to contract to pull myself up. So as my hamstrings and my lower back contract, holding myself up, they become hyperfacilitated, and that creates weakness in my abdominals.
This graphic shows how the muscles alternate in a cross-link fashion between hyperfacilitation and inhibition. This cross-link of weakness and tightness creates an increased sway back and a protruding abdomen. This is also known as a Donald Duck posture.
So how can we correct lower cross syndrome? There's 4 exercises for strengthening the back, and there's 4 exercises to help lengthen or stretch out the muscles that are facilitated. Our goal is to stretch out the muscles that are pulling too tight and strengthen the muscles that are inhibited. So the muscles that we want to stretch include the hamstring, the hip flexor, and the lower back muscles. The muscles that we want to strengthen are the quadricep, the gluteal muscles, and the abdominal muscles. First, we're going to review the stretchers or the lengtheners. We want to use a foam roller to help stretch out the hamstrings, the IT band, or the lower back muscles. And Miss Mickey's going to demonstrate on how to use the foam roller here. So we're going to have Miss Mickey get up onto the table here. And Miss Mickey's going to demonstrate how to foam roll her hamstring muscles. She's going to start right at the base of her pelvis, which is the sit bones. The sit bones are right where the hamstrings attach. And she's going to roll back nice and even. She's going to just let her body weight. She's not going to go past the knee. She wants to make sure she stays on the hamstring, but doesn't go past the knee joint because she doesn't want to put too much trauma on those knee joints. Just using your body weight and rolling will create quite a bit of pressure to help stretch out and loosen up those muscles. Another effective muscle that we can roll out is the IT band. Oftentimes the IT band gets really tight because we often internally rotate our feet as we cross them under our chair. So to roll out that IT band, we're going to turn on our side. Again, Miss Mickey is going to stay on the thigh. She wants to go from her hip bone and not go past the knee bone or the knee joint as she rolls out the IT band. Another effective stretch for lower cross syndrome is a hamstring stretch utilizing a TheraBand. We're going to use this green TheraBand and create an eccentric contraction to help stretch out the hamstring. So Miss Mickey's going to lie face up on the table here. Just going to hold on to this, and we're just going to place this right on her heel so she has something to hold on to. She's going to pull up on that cord, and she's going to take her leg and contract the hamstring and just bring her leg down gently. Although the hamstring is contracting, the muscle is actually lengthening. So this creates an eccentric motion which will help rehabilitate the hamstring and take off a lot of that tightness. To help stretch out the tightness in the lower back, we're going to utilize a cat-camel stretch. We're going to have Miss Mickey get into a crawl position here onto the table. And to stretch out the muscles for the cat-camel, we're going to have her lift her back up, like there's a string pulling her back up, straight up towards the ceiling. As she comes up, her back is into flexion, her head comes down. Now she's going to push her stomach straight towards the table, and as she pushes her back in, it's going to extend, and her head is going to come back up. So here she's stretching an extension, then she's going to come back up and stretch in flexion. And you just repeat this in a pumping motion at your pace for about 1 to 2 minutes. A very effective stretch for the hip flexor is the warrior stretch. The warrior stretch is a yoga move that will help open up the hip flexor and the psoas muscle. Mickey's going to demonstrate that by kneeling in a forward position. The hip flexor is this muscle here, and she's stretching by going forward, putting tension on the hip flexor, which is that leg, the left leg in the back. As she elevates her arms and extends her back, that helps increase the tension on that psoas, which attaches right up to here. I also want to share with you 4 exercises that will help strengthen the back. Again, the muscles that we want to strengthen are the quadricep, the gluteus maximus, and the abdominals. Our first exercise is a supine back extension exercise. We're going to have Miss Mickey lay on the table face up, and this is designed to help strengthen the core. We're going to work on activating the gluteal muscles and the abdominal muscles together. We're going to do this in a very easy plank formation. For anyone that's starting a plank, this would probably be the ideal place to start. We're going to have Miss Mickey stay on her shoulders. She's going to lift her body up. She's as flat and as strong as a board, and she's just holding that position. She's going to contract, squeeze the gluteal muscles, and then after a couple of breaths, she's just going to lay back down and relax. She's going to repeat this for about, starting off with maybe 20 to 30 seconds and working her way up to about 2 minutes. The next step up for strengthening the core will be a prone plank position. So Miss Mickey is going to turn over into a prone position. And a prone plank is like doing a push-up without the push-up. She's just holding herself up. She's making herself as strong as a board. She's supporting herself with her elbows. But really where the strengthening is occurring is here in the back muscles and the abdominal muscles by contracting the transverse abdominal muscle. That's a muscle that goes completely around the body like a corset, and that's one of our chief core muscles that we want to strengthen for lower cross syndrome. A slightly more advanced move to help strengthen the core is a pelvic tilt. We were going to work on a pelvic tilt. Miss Mickey is going to work on an abdominal breath. When she breathes in, she's going to take a deep breath. The abdomen should come up when she breathes in. When she breathes out, the abdomen should flatten or hollow out. The second part of this is I'm going to put my hand under her back. She's going to flatten her back on squeezing my hand into the table. Notice how the pelvis rolls back. As that pelvis rolls back, she's going to take 3 abdominal breaths while holding that. And you can see how her pelvis rolls back. That posterior pelvic tilt is what we were trying to achieve, strengthening the abdomen muscles and the back muscles together. The last strengthening exercise I wanted to share with you is a squat facing the wall. The squat facing the wall is going to ensure that the quadricep muscles are being activated, the gluteal muscles are being activated, and that we're not accessing the hip flexors. This is going to make sure that the pelvis comes back in the proper position. You want to start off with a lighter weight and work your way up. You might want to start with 6 to 8 repetitions and then work your way up as your muscles become more accommodated to this exercise. And there you have it. These are the exercises that are going to help reduce lower cross syndrome and eliminate the back pain in your lower back. I want to thank Miss Mickey here, my patient and friend here, for helping me demonstrate these exercises today. Stay tuned next week where we are going to talk about upper cross syndrome.